Today I've been asked to do a procedure called an arterial blood gas. This involves taking some blood from the artery in the wrist. I'm going to use some local anaesthetic, so it shouldn't be painful, but it might be a bit uncomfortable.
This is an instructional video. This is an instructional video about how to collect a capillary sample from a neonate. When sampling, be sure to always follow your hospital's procedures. Before sampling, confirm the patient's identity. Make sure there is good blood flow to the sampling site. Disinfect the puncture area. Make an incision of maximum 2 millimeters depth on the plantar.
Hey everyone, it is Professor Lee. So I'm going to show you how to put a urine collection bag on an infant or a baby who is still in diapers.
Ya, Assalamualaikum. Dengan umur kita Al-Fatihah.
Waalaikumsalam. Can we start with it?
Doctor, can we start now?
Ya, Assalamualaikum. Boleh start lah, boleh start.
All right. Okay. Thank you, Doctor. Am I audible? Right. Okay. Assalamualaikum, everyone. Thank you very much for joining us. So today we'll be talking about the procedure-based seminar. Thank you very much to Doctor as well for joining and supervising. So I'm Hasnan bin Tahir, and I will begin with arterial and venous blood gas. Next slide. So blood gases are measurements used to evaluate patients' oxygenation and acid-base status. So whenever there is imbalance in acid-base, difficulty of breathing or shortness of breath, that is when we will be taking these blood gas measurements. So the components of blood gas measurements include partial pressure of oxygen, partial pressure of carbon dioxide, pH, bicarbonate, oxygen saturation. Before we go into it, I would just like to indicate what is the difference between ABG and VBG, venous blood gas. So VBG and ABG are actually comparable except for partial pressure of oxygen and partial pressure of carbon dioxide. Otherwise, the values are quite similar according to the studies made. Next slide. So what are the indications for ABG or VBG? So let's go it from reverse. So whenever we are expecting there to be acid-base imbalance, whether it's metabolic acidosis, alkalosis, respiratory acidosis or alkalosis, so that is when we will have to take this measurement. So the common causes could be, as has been indicated in the next column. But we have to understand that when it comes to VBG, because the partial pressure of oxygen and carbon dioxide is not that correct, so we will have to take ABG when it comes to respiratory problems. So other than respiratory problems, we can take VBG, but when there is respiratory problem, then for example, if we are expecting respiratory acidosis, alkalosis, then we will have to take ABG, right? Next slide. So at here, this is just the conditions that could causing respiratory failure. So it could be condition that affects the flow of blood into the lungs, condition that affect the nerves and muscles that control breathing, conditions that affect the areas of the brain, conditions that affect the flow of air in and out of the lungs. So it is all indicated in this picture. Next slide. So what can be the complication of this procedure? It includes, as it could be in any other puncture as well, local hematoma, arterial vasospasm, arterial occlusion, this is for AVG, air or thrombus embolism, infection at the puncture site, needle stick injury to healthcare personnel, and vessel laceration. Next slide. So these are some of the these are the equipments that will be needed, and we will just go through it as I'm explaining the procedure. Next slide. So when I'm talking about this procedure, what I'm talking about is what are the requirement that we need when we are doing these procedures, as has been highlighted by the KKM. So first of all, for the preparation for patients, we have to make sure that the respiratory condition of the patient is stable, and the patient should preferably be in a steady state of ventilation before and during the collection of blood sample. The patient should be informed about the procedure to avoid unnecessary anxiety, and if the patient is hyperventilating due to anxiety, pH and blood gases may be affected. So this is the tube that we use, which is syringe with anticoagulant. Next slide. So for arterial blood gas, this is the most preferred and recommended type of blood for pH blood gas analysis. But as I've already told before, the indications for ABG or VBG, so it can alter. So it gives the best information about the oxygen uptake in the lungs and oxygen transport, as I've said about the partial pressure of oxygen and even carbon dioxide as well. So it need to be, but we have to remember that when we are doing ABG, we will have to do modified Allen test beforehand. So in the video, they have already showed how to do modified Allen test. It is to make sure if the radial artery is punctured or anything happened to the radial artery, the ulnar artery can still supply blood to the hand. Okay, so what we'll do is we'll compress both of the arteries and then ask the patient to clench their hand. And when they open, we will release the ulnar artery to see if the hand become red again in 5 to 15 seconds. It is in the video, so you guys can watch it. For venous blood gas, not generally recommended, but and it should not be used to evaluate oxygen status, but it can be used to reflect acid base such as pH and bicarbonate. Next slide. So the procedure of sample, we have to indicate the time of arterial venous puncture in the request form. Use a 1 milliliter disposable syringe. If using regular syringe, rinse it by sucking heparin into the syringe and expel excess heparin solution from the syringe. And then we use the alcohol to clean and then allow the alcohol to dry completely. Draw about 1 milliliter of blood, invert this syringe upward and expel all air bubbles, and mix well by rolling between palm for 5 seconds as it is in the picture. Right, next. So as you guys have seen, the houseman will be carrying this ice box here and there. So the syringe is placed in a specimen plastic bag or container containing water and ice. You have to make sure that the blood is in the syringe, immersed completely in ice water. The sample must reach the laboratory for analysis in 30 minutes after drawing of blood, which we see in the ward as well when the housemans are running to deliver the blood. Next. So this is the video.
Hi there, my name's Andrew. I'm one of the final year medical students. Could I just check your name and date of birth, please?
Sure, it's James Alexander, 13th of December 1989.
Nice to meet you, James. Today I've been asked to do a procedure called an arterial blood gas. This involves taking some blood from the artery in the wrist. I'm going to use some local anaesthetic, so it shouldn't be painful, but it might be a bit uncomfortable. Is that okay?
That sounds fine.
Can I just check before we begin? Have you ever been told you have problems with your circulation?
No.
Okay. Do you take any blood thinners, such as warfarin?
No, I don't know.
Okay. And have you ever been told that you have problems with clotting?
No.
Brilliant. Can I also check, James, do you have any allergies at all?
No, I don't.
Brilliant. I'll just gather my equipment. James, I'm just going to do a quick test to assess the blood supply to your hand. Could you just make a very tight fist for me? And hold it there. I'm now going to press on each side of the wrist. Keep your fist as it is. And relax. James, that's the end of the procedure. Thank you very much.
All right, I think that's it. If there's no question, we can proceed with the next presenter.
Okay,
Bismillah.
so I've got a few comments. Number one is, be careful with your reference because your figures, for example, not only your reference lah, your figures, your table and your content lah. Make sure it's not a lay people punya resources because you tend to use their language. Ideally, because this is a scientific punya presentation kan, your presentation should use technical word lah, medical technical word. Macam tadi kan, lung problem, brain problem. Rather than that, you have to be specific on the pathology, like VQ mismatch. That's the terms yang the pathology that we expected to hear lah. So be careful with that. Secondly, kalau boleh make sure video pits. And you boleh skip lah all the videos you just share with your friends untuk tengok. But your presentation, you don't have to include the video, I think. Okay, next.
Okay, thank you, Dr. Bismillah. I'm going to present about the capillary blood gas. My name is Wajiha. Next slide. This is a table of contents. Next.
Sorry, lagi satu. One more thing is, for the blood gas, you also need to know what can cause error in the blood gas interpretation. Because blood gas ni selalu masuk exam. So you need to know the type of error that can occur. For example, like I give you one clue lah. If you got polycythemia, then it will affect the reading by Y. How it affect the reading. And for example, kalau you tak guna ais, apa jadi? Kalau you shake banyak sangat, what jadi? Apa jadi? Too much heparin, oxygen contamination. These are all the errors that can occur with blood gas analysis. And you have to aware of this. Okay, next.
Okay, thank you, Doctor. So for the introduction, capillary blood gas is actually a sampling method that we use when we puncture the skin that has a highly vascularized area, includes the finger, heels, and also the earlobe of the patient. It is an alternative to the arterial blood gas to analyze patient oxygenation, ventilation, and also acid-base balance. The good thing is that it is less invasive, needs a smaller amount of blood, and also can be done quickly and also easily. Next slide. So the indications for the capillary blood gas include when the arterial and venous access is not available, when the non-invasive readings shows abnormality, or if there's any alteration in the child's clinical status, depending on the history and also physical examination, or we want to monitor patient severity and also progression. Next, if you want to comment or alteration in between the invasive and non-invasive ventilation for the child. Last but not least is to minimize the amount of blood sampling in preterm babies, as a substantial amount of blood loss may lead to the anemia in preterm and neonates. For the contraindications, it is contraindicated to be done in patients less than 24 hours old when there is a direct analysis of oxygenations. For example, if we need an adequate information about the oxygenation of the patient. When the patient is hypotension, hypovolemia, as well as has right-sided heart failure. And next is there is peripheral vasoconstriction, and there are also sites or locations that cannot be used for injection, such as cyanotic area, fingers of the neonates, or any inflamed or edematous tissue. For the complications, it can cause patient to have pain, hematoma, bruising, or scarring, and worse than that, it can lead to infections such as osteomyelitis or cellulitis, nerve damage, as well as a tibial artery laceration. And it can also lead to inappropriate management from the non-reliance value of the capillary blood gas. Next. So these are list of the equipments. We need the lancet or the heel prick device, the heparinized capillary tube or the collection tube for the blood to be collected, alcohol swab, and also the gauze swab. Next. So before we start, we need to know the site for the capillary sampling. It depends on the age and also the weight of the patients. If it is from the birth up until 6 months, or the weight between 3 kg to 10 kg, we can prick the heel. But if it is more than 6 months and the weight more than 10 kg, so we can prick the finger at the second or third finger. For the puncture side of the heel, we can prick at the medial or the lateral plantar surface. For the finger, we need to do it perpendicular to the fingerprint. Next. So this is the illustration. You need to be perpendicular to the fingerprint. Next. And the shaded area is the area where we prick the heel. Next. So this is the steps. I believe you guys can read it later. And also the illustrations of the steps. Next. So this is the video. Inshallah, you guys can watch it later. That's all from me. Thank you.
Oh, very good. Okay, kan, ada soalan?
Doctor, do the interpretation of the capillary and ABG, venous ABG or arterial ABG is the same?
It's the same. But remember lah, if you want to assess the oxygenation, you cannot use capillary lah. It should be ABG. But capillary, one good about capillary, I mean, usually we use capillary for mainly to know the pH and also to actually to look for trend. Look at trend lah. Macam if you are doing like serial, then that's good. If you are doing like 1 point CBG, then there's no use. CBG ke VBG ke 1 point is no use. It's more to look for trend, progress, disease progress. And then one more thing is apa tadi? Itulah. And by the way, your blood gas, only 3 things are actually measured. Okay, only 3 things are measured. The rest are actually derived from the calculation, lah. So the only things that is accurate in the blood gas is actually your pH, oxygen, PaO2, and PCO2. That only 3 je are measured. The rest, so for example, bicarb, best access, the machine calculate based on the pH, based on the CO2, dia akan work out what is the bicarb level and what is the best access level. Okay.
Okay, I'll proceed the presentation with central venous line incision. My name is Farhan Khalihin from Himalaya. Right, so okay, a central venous catheter is an indwelling device that is peripherally inserted into a large central vein and advanced until the terminal lumen of the catheter resides within the inferior vena cava, superior vena cava, or right atrium. So in infant and children, the 4 primary sites for central venous access are femoral vein, subclavian vein, internal jugular vein, and also umbilical vein. For internal jugular vein cannulation, it causes less thrombosis compared to other sites and can easily apply pressure in the case of arterial puncture. However, it can cause pneumothorax and thoracic duct or brachial plexus injury. For subclavian vein cannulation, it has a lower complication rate compared to cannulation of internal jugular vein. That's why it is more preferable than internal jugular vein cannulation. Plus, it is good for mobile patients. Femoral vein is the site used most frequently by pediatric emergency physician because it is easy to access and is distinct from major site of activity during resuscitation. However, it is not desirable for long-term access in mobile patients. Lastly, umbilical vein is used to insert central cannulation central venous catheter for neonates younger than 10 days of age. Okay, when choosing a catheter, we must also choose the appropriate types of catheter according to the needs of the patient. For example, tunnel and non-tunnel catheter. Tunnel catheter are placed under skin and meant for be used for a longer duration. Meanwhile, non-tunnel catheter are designed to be temporary. Implantable port are most useful for children requiring intermittent venous access over a long period of time, such as chronic disease with exacerbation like cystic fibrosis. It requires less maintenance and a patient is allowed to bath and swim. Lastly, a peripherally inserted central catheter or PICC can be left in place for weeks or months at a time. So it is used in patients who need extended course of medication such as chemotherapy. Okay. Central venous line insertion is indicated in patients with difficult peripheral vein access, such as patient with which is severely dehydrated. It can also be used for frequent blood draw in critical patient and longer time intravenous infusion like nutrition support, and also infusion of large volume of irritating substance, such as chemotherapy or contrast agent for imaging studies. It can be used also for obtaining central venous pressure in patients with persistent hypotension, trauma, sepsis, or burn, and it can be used as well for hemodialysis. But it is contraindicated in patients with bleeding and clotting disorder. Patient with severe abdominal trauma cannot use femoral vein incision. Patient with skin lesion or infection at the site of incision. Patient is known for venous thrombosis of the vessel, and also there is no absence of trained doctor to reduce the risk of complication. Okay, so as for the equipment, before starting the procedure, we must explain the procedure to the patient and the parents and obtain verbal consents. So the equipment that will be needed is sterile set, Seldinger cannulation set, lidocaine, shrink, needle, normal saline, and sterile dressing. Okay, why we need a sterile Seldinger cannulation set? Because we'll be performing Seldinger technique. So this Seldinger technique, it allows the insertion of a catheter larger in diameter than the needle originally utilized. So these are the steps of inserting the central venous catheter using the Seldinger technique. Okay. However, this procedure can cause a lot of complications such as bleeding and hematoma, bowel or bladder perforation for femoral vein insertion, hemothorax, pneumothorax, air embolism for intravenous vein and subclavian vein insertion, malposition, gut wire knotting, or loss intravascularly, infection, impact venous return, and deep vein thrombosis. So basically, this is the video provided, and you guys can watch it. From me. Thank you.
If there is no question, I will proceed with the next procedure, which is urine culture and sensitivity. My name is Dr. Farhana. Okay, next. Okay, so what is urine culture and sensitivity? Urine culture is a test to go and find the causative organism that most likely causing urinary tract infection, such as bacteria, E. coli, Klebsiella, or Pratis mirabilis. Meanwhile, sensitivity test is a test to identify what is the suitable medications or antibiotics to treat the UTI. So basically, urine CNS is a gold standard to diagnose urinary tract infection. Okay, next. What is the indication of the urine CNS? First is if the child comes with symptoms of UTI such as fever, vomiting, diarrhea, and etc. Second, urine CNS is done as a part of evaluation of sepsis without a clear source such as febrile neonate. Third, urine CNS also done as a workup of patients with isolated fever and altered mental status. Okay, next. Before we do urine CNS, urine specimen must be collected. So urine specimen collection can be done in outpatient or in ward. It can be divided into two, which are invasive and non-invasive specimen collection. So for non-invasive, there is a urine bag and clean catch method, which is much cheaper and easier to do. However, have a high risk of contamination from surrounding organism. For the invasive method, such as graded catheterization and suprapubic aspiration, is much more preferable, as most hospital settings nowadays are already well equipped with technology such as ultrasound-guided suprapubic aspiration. Although it is quite invasive, but it carries less risk of contamination, in which UTI can be properly diagnosed and treated accordingly. Okay, next slide, showing the procedure of how urine specimen collected by urine bag, but it actually rarely done due to high risk of contamination rate from perianal area. You can watch it later. Okay. Second, non-invasive method is a clean catch technique. Actually, this method is preferably in child that is already toilet trained or able to understand instruction, as the specimen that we need is midstream urine. So the technique is similar like adult. We will instruct the patient with the help of parent to clean the genitalia properly with antiseptic and allow few drops of urine to flow first to wash the urethra before collect the urine. Okay. Next. This is a invasive type of urine specimen collection, which is the most commonly done in our hospital setting. So bladder catheterization, the equipment that needed for bladder catheterization, including a dressing set, local anesthetic gel, shrink, as well as urinary catheter. So based on its protocol, if the weight is less than 3 kilogram, we can use 4 French catheter size. If more than 3 kilogram, can use 6 French catheter size, and etc. Okay. Next is this is the procedure, more or less similar like bladder catheterization in adults. You can read it later. Okay, so this is actually the video of suprapubic bladder aspiration. This is the gold standard for urine sample collection for urine CNS. I think you can watch it later. Okay, after urine specimen is collected, so next we will incubate the specimen on medium agar plate for 24 to 48 hours at 87 degrees. So it is positive if there is growth by suprapubic aspiration. If there is more 5 times 4 meters to the power of 4 CFU per mil by urethral catheterization, or if there is more than 10 to the power of 5, if we collect the urine by using clean catch. So basically, different method of urine sample collection has different cut-off point in order to diagnose as UTI. Okay, so when there is the result is positive, we will proceed with gram stain test to identify the antibiotic susceptibility test. Okay, next. As for the complication, if the urine is collected by using urine bag, there is high risk of contamination from the colonized perineal area or distal urethra. If we use a bladder catheterization, even though it carry less risk of contamination, however, it can lead to trauma, bleeding, as well as infection. And last but not least, suprapubic bladder aspiration might cause microscopic hematuria due to trauma to bladder mucosa, and if worse, can lead to viscous perforation as well. Okay, I think that's all from me.
Okay, I've got one question. What type of antiseptic you use for bladder catheterization?
Is it povidone, Doctor?
Povidone.
I see in a video actually.
Video tu adult ke?
Child.
Berapa tahun?
Berapa tahu in the video.
Itu suprapubic catheter ke apa?
Suprapubic catheter but ultrasound guided, by ultrasound guided.
Baby.
Yeah, in the video that I provided.
Because usually we don't use ultrasound guided lah. So suprapubic catheter is very easy, it's very simple, just cocok je. Just you palpate the pubic symphysis and then you cocok. I know kalau kat overseas everything is done like few step with additional few steps kan. Cuma povidone we don't use povidone in pediatric, especially in neonates and young children, because it can affect your thyroid. This is something yang already accepted lah. So never use povidone in pediatric. We never use povidone lah in general. Except in older children, kita boleh guna povidone because it can be absorbed through the skin. Especially for and different antiseptic should be used for different method. Okay, you don't use like high concentrated chlorhexidine or alcohol for bladder catheterization using catheter. Okay, for using CBD lah, Foley's catheter, because it's painful. Because the skin down there is quite sensitive lah. But rather kalau you pakai, tapi kalau you buat suprapubic, then you use higher concentration of CHD lah, CHG. So okay lah. Okay, siap dah?
Dah, teacher.
Okay, good. Next. Ada soalan? But remember, be careful. You have to note the definition of UTI. Okay, don't simply, because later you'll notice a lot of doctors, they just said, oh, UTI, clinical UTI. There's no such thing as UTI just because of urine got 1 or 2 plus leukocytes. You cannot say it's UTI. So you need both culture and also FEME to say it's UTI. Okay, unless kalau you memang buat gold standard lah, you buat bladder you buat suprapubic super aspiration, then that's acceptable. Kalau you just use the FME, then that's quite okay. Tapi kalau midstream ataupun back sample especially, you can ada both. Okay, next.
That's all, Dr. Semua dah present.
Oh, very good. Okay, bagi you extra mark lah cepat sangat. Sebab 4 je lah.
For student.
Okay, first study apa? First study is ABG, second CBG, third central catheter, kan? Fourth CBD.
Urine CNS.
Urine CNS. Okay, kan nanti I bagilah markah you guys.
Okay. Doktor bagi terus dekat Sister Farah.
I WhatsApp jap.
Okay.
Tak, I bagi kat you guys lah. Farah ada cuti lah.
Oh, okay.
Okay.
Thank you, Doktor.
Okay, assalamualaikum.
Thank you, Dr. Waalaikumsalam.